Okay, hello. My name is Katia Apedoh, and today I, along with Shelvyn and Isaac McCollum, will be discussing the diet, the microbiome, and mental health. So essentially, there's a relationship between the way your brain works and the bacteria in your gut, also along with the food that we eat. The second factor is what is deemed the gut microbiome, also referred to as the microbiota. All that will be discussed by my fellow researchers. However, I will be discussing the connection between the first and third factors, mental health and diet. So they always say that you are what you eat. And who would have thought that the foods that we eat can affect the way that we feel? Well, according to a study conducted by Canadian Psychiatric Association, the general advice about diet is to 1, increase your take of fermented foods, such as yogurts, kimchi, other foods like that. And in terms of what the bacteria may be craving, research suggests that the Mediterranean diet is protective against depression. The Mediterranean diet consists of a diet mostly based in vegetables, fruits, and whole wheat grains. It's incredibly high in fiber, high in protein, and high in healthy carbohydrates. But really what sets this diet apart from the rest is that this diet particularly doesn't aim to eliminate the macromolecules that are healthy for your body, and doesn't try to deprive your body of it, rather than to take in all of those healthy carbohydrates and limit unhealthy factors such as saturated fats.
Now, what exactly is the microbiota gut? The microbiota gut is made up of trillions of microorganisms and specific genetic materials which live in your intestinal tract. And in this image to the right, you can see the different genetic materials as they're blocking specific pathways of the intestines. Now, the microbiota gut-brain axis has multiple factors that play a role. These factors consist of diet, stress, infant feeding, birth process, life cycle stages, and geography, and other features. The specific outcomes of microbiome factors occurrences refers type 2 diabetes. Now, type 2 diabetes starts off when the stomach converts the food to glucose, then the glucose enters the bloodstream, and then the pancreas produces the insulin but is resistant to effective use, and then the glucose is unable to enter the body itself, and then the glucose levels would begin to increase. And then the inflammatory bowel disease is an occurrence with corruptions within the tissues, and then last but not least, autism, which is seen through disruption within the birth of the individuals.
Looking now at the effects of specific bacteria, we find that low quantities of Faecalibacterium have been linked to both MDD and bipolar disorder, indicating this bacteria may be a valid treatment target for the depressive symptoms of schizophrenia. This bacteria's effect on mental health stems, at least in part, from its production of the short-chain fatty acid butyrate, which has been shown to have antidepressant properties in some mammals. The quantity of this bacteria can also be elevated relatively easily by simply including more fiber in one's diet. A number of other studies found significantly higher levels of bacteria of the genus Lactobacillus in patients who either had schizophrenia or were at risk for developing it, and there was also a strong correlation with symptom severity. Lactobacillus bacteria are generally considered beneficial, helping to protect the host against pathogens, and some species seem to have positive effects on other mental illnesses like depression, but the properties of each species are largely unexplored, especially with regard to mental health. These bacteria are among the most common found in probiotics and fermented foods, so dietary adjustments or probiotic supplements intended for patients with schizophrenia should consider special caution towards lactobacillus bacteria. Current research on the gut microbiome suggests a great deal of potential for a diet-based approach to treating schizophrenia. The traditional Mediterranean diet includes fiber consumption nearly double what is common in many industrialized countries, meaning it promotes the growth of butyrate-producing gut bacteria, and it also confers a number of other health benefits, including protection against inflammation and obesity. Low-grade inflammation is commonly observed in schizophrenia, and some hypothesize that this inflammation could be one of the primary factors in the development of the disorder. Obesity displays a high degree of comorbidity with schizophrenia, in addition to being a common side effect of long-term antipsychotic usage. Not only can eating patterns like the Mediterranean diet substantially reduce the severity of schizophrenia comorbidities like depression and obesity, but they can potentially alleviate some symptoms of the disorder itself by decreasing inflammation and lactobacillus intake, substantively improving the quality of life for those affected by schizophrenia. Here are citations, and thank you for watching.